Today I will be doing shoulder flexion and extension using a goniometer to take the measurements. The patient positioning is seated, good posture, feet on the floor. The axis of the goniometer will be placed on the acromion process of the shoulder joint. The fixed arm will be pointed directly at the ground and the movable arm will be in line with the humerus. You will have them actively perform the range of motion. You will keep the movable arm in line with the humerus and you will take your reading. He has about 170 degrees, which 180 is normal, so that's within normal limits. Next, I will be doing shoulder extension using a goniometer to take the measurement. The patient positioning is the same as shoulder flexion. I will take the axis of the goniometer. Well, the goniometer positioning is the same for shoulder flexion as well. The axis of the goniometer will be placed in the acromion process. The fixed arm will be pointing directly at the floor, and the movable arm will be in line with the humerus. You'll ask the patient to perform the range of motion. You'll keep the fixed arm still and move the moving arm with the humerus. You'll take your reading. He has approximately 55 degrees of shoulder extension, which 60 is normal, so that's within normal limits. Today I will be performing shoulder abduction and using a goniometer to take the measurement. The axis of the patient positioning is seated, feet on the floor with good posture. The axis of the goniometer will be placed on the posterior corner of the glenohumeral joint, so I will palpate and find that. The fixed arm will be pointed directly at the ground, and the movable arm will be in line with the humerus. You'll ask the patient to then perform the range of motion. He has approximately 175 degrees. Normal is 180 for this range of motion, or for this movement, so that's within normal limits. Today I will be performing internal and external rotation using a goniometer to take the measurement. The patient positioning for both of these will be seated with the feet on the floor, good posture. You will abduct your shoulder to 90 and flex your elbow to 90. You will have the axis of the goniometer on the olecranon process. This will be internal rotation. You'll have the axis of the goniometer on the olecranon process. The fixed arm will be pointed at the ground, and the movable arm will be in line with the ulna and the ulnar styloid process. You'll ask the patient to please perform the range of motion. You'll line it up with the ulnar styloid process, and he has approximately 65 degrees of internal rotation. Normal for that range of motion would be 70 degrees, so that's within normal limits. Then, external rotation, the same exact concept. You'll take the axis of the goniometer and you'll place it on the olecranon process. You'll take the movable arm and line it up with the ulnar styloid process, and the fixed arm will stay pointed at the ground the entire time. You'll ask the patient to perform the range of motion. You'll take the goniometry measurements, measuring with the goniometer to the ulnar styloid process. You'll read the goniometer. This says approximately 88 degrees, which 90 would be normal, so he's within normal limits. Now we'll be performing horizontal abduction and horizontal adduction of the shoulder joint using the goniometer to take the measurement. The patient positioning will be seated, feet on floor, good posture, shoulder flexed 90 degrees. The axis of the goniometer will be lined up on the acromion process of the shoulder. The movable arm will be in line with the humerus, and the fixed arm will be pointed directly behind the arm with the humerus, and it will stay there. You'll basically start off with the 180, and then you'll ask the patient to please perform the range of motion, keeping the movable arm in line the entire time. You'll then read the range of motion, and this says 88 degrees, and normal would be 90 for that movement, so he's within normal limits. The same concept goes for horizontal adduction. You'll line the axis of the goniometer up the acromion process, and you'll go a 180 down the humerus and pointed directly in a straight line. And then you'll ask the patient to perform the range of motion. You will take the range of motion reading, and this says approximately 45 degrees, and 45 degrees would be the norm for that range of motion movement. This will be manual muscle testing for the shoulder, more specifically flexion and extension. The object of manual muscle testing is to test how strong the athlete is, or do a bilateral comparison to see if there is weakness on one side versus the other. You will first ask the athlete to perform the range of motion. through a full range of motion. So can you please flex your shoulder as far as you can? Okay, thank you. That would be at least a 3 because he's moving against gravity, and then you would test their strength by having them go halfway through the range of motion, and then applying a downward force against the range of motion and asking him to hold it. Hold your position. Okay, and he didn't break, so that would be a 5. Next would be shoulder extension. He performs the range of motion. He has full range of motion, so you would then skip the 3 and go straight to see if he has a 4 or 5. You would then apply a backwards force against his resistance, and he holds, so that would be a 5 out of 5. Next would be shoulder abduction, which you ask him to perform the range of motion. He performs it through the full range of motion against gravity, so that would be at least a 3. You would then ask him to go abduct his arm to 90. Thank you. And then you would apply a downward force, and he doesn't break, so that would be a 5 out of 5. Now I will be performing the manual muscle testing for internal and external rotation of the shoulder. You will first ask the athlete to abduct their arm to 90 and then to flex their elbow to 90. You would then ask him to perform external rotation, and he does through a full range of motion. He would then perform it again, and I would press against and have him hold there. Okay, he holds, so that's a 5 out of 5. Then internal rotation, same concept. Have him perform the range of motion, come back up, go back down, and then I would apply a force against him, and he would hold. And he holds, so that's a 5 out of 5 as well. Next is horizontal abduction and horizontal adduction. You would ask the patient to perform the range of motion. He performs it through a full range of motion. He would then do it again, and you would apply a resistive force, and he has to hold. He holds, so that's a 5 out of 5. Then horizontal adduction, same concept, perform the range of motion. Goes back, and I apply a force against him, and he holds, that's a 5 out of 5. Now I'll be performing 5 common special tests that are done on the shoulder to diagnose common shoulder pathologies and injuries, both musculoskeletal and nerve and circulatory. The first test I'll be performing will be Ludington's test. This is a test to test for bicep tendon rupture or tendinopathy of the bicep. The examiner will ask the patient to please interlock his hands and place his hands on top of his head, like so. He will then ask the patient to contract his biceps bilaterally, and you will do a bilateral comparison to see if both of them move equally and that both of them are contracting. If one is not contracting, that could be a significant sign of either a bicep tendon rupture or of tendinopathy of the bicep tendon. The second test I will be performing will be the empty can test. The patient positioning will be standing. The examiner will ask the patient to then flex his arms and then adduct them to 90 and hold that position and pronate his hands and point his thumbs towards the ground. The clinician will then come in front of the athlete and apply a downward force and ask the athlete to hold and do a bilateral comparison of strength on both sides. This is testing for supraspinatus, the supraspinatus rotator cuff muscle, and if a significant drop or weakness is found bilaterally, then that could be an indication of a rupture or a tear in the supraspinatus tendon. The third test will be Roos test, and this test for thoracic outlet syndrome. The patient will perform this position with his arms abducted and elbows flexed to 90 and hands above his head. He will then begin to open and close his fingers rapidly for 3 minutes, and you will monitor any change in symptoms, any type of fainting or numbness or tingling, any symptoms at all really that he can report, you will note. And if this test is positive, there's a good chance he has thoracic outlet syndrome, and you need to refer to a doctor ASAP. The fourth test that I will be performing will be the spring test. This test for the AC joint, the acromioclavicular joint in the shoulder, and this is also called the piano test. So what you're going to do is you're going to come and you're going to palpate the AC joint and find where it steps off, and then you're going to apply a downward axial load basically and press down on it. And what you're looking for is that to spring back up whenever it comes. Any type of laxity or crepitus or anything like that could indicate a tear in the AC ligament. The Gerber liftoff will be the last test that I'll be performing. This test for subscapularis rupture. You'll ask the patient to please place his arm behind his hand, or his hand behind his back, and then what you'll do is you'll ask them to please lift their hand off their back like so. Inability to do this would be a really good sign of subscapularis involvement or something, or a rotator cuff muscle, but more specifically the subscapularis. Those are 5 common special tests for the shoulder that are good for diagnosing common shoulder pathologies and injuries.